welcome to the Pulse Collective podcast.
Hello, everybody, and welcome to today's episode of the PCP, otherwise known as the Pulse Collective podcast. As always, I'm your host, Shahrukh Ansari. The PCP, for those of you that are just joining us for the first time, this is the show where we sit down with top business leaders, entrepreneurs from all across the industry, and we like to sit down and talk about everything sales, marketing, operations, and just different tips that we can see to fuel your businesses forward as well. So grab a chair, sit down. We're going to have a fun conversation today. Also, for those of you just joining us, we are Pulse Collective. We're a growth partnership that partners with businesses all across the country. We sit down and figure out AI-related initiatives that can actually help improve your efficiency, whether that's lead generation, lead engagement, just overall scale your business to the next level. If that's something you're looking to do, or maybe tap into a more modernized way of scaling, drop us a message down below, and one of our consultants will reach out and see if there's a potential fit for us to work together. Now, with all that out of the way, I'm very, very excited because today I actually am joined by Paul Muchowski. Paul is actually the founder over at a company that's very, very cool called Define Sleep. It's actually a sleep-focused company that's developing plant-based and also clinically tested formulations that are designed to improve sleep quality rather than just induce sedation. And there's a lot of similar but very, very different products on the market right now. But we're actually going to talk about sleep cycles a little bit. I know Paul's going to get into that. And I'm really, really excited to see kind of like what this product is and hear a little bit more about your background. I'm sure the audience will find a lot of value in this. So, Paul, welcome to the show.
Thank you, Shahrukh. Happy to be here.
Great. I mean, let's really start it off from the top, Paul. Let's get into a little bit about you. Can you tell us a little bit more just about Define Sleep, your product, and who are the clients, and what is your actual vision for the company as a whole?
Sure. Yeah, Define Sleep is essentially a biotech company that has developed a novel sleep aid that, as you mentioned, is a plant-based sleep aid that essentially is available direct to consumer right now in the United States. And I can get into all the details of what it actually is, but basically what sort of differentiates us compared to just about everything else in the whole sleep aid area is that we very carefully spent many years doing research and development on this product. So we took this biotech approach, spent years on formulating it, and then we ended up taking years undergoing rigorous clinical testing and FDA-registered clinical trials, and even published those trials. And so we did all of that because we really wanted to know everything that we could about this product to make sure that, number one, it's safe, and number two, that it works.
I find it really, really cool because recently there's been an increasing shift that I've noticed with people actually trying to get not just more hours of sleep, because everybody's heard the whole getting 8 hours of sleep a night is crucial to just optimal body function. But what I've noticed, and a lot of people are noticing now, is the quality of sleep. And we're starting to educate ourselves more about just sleep cycles and the importance of that. I really want to get into that. But before we do, I do want to tap into just you personally. What is your background? I know you obviously are a holder of a PhD as well. So what is your background, and what really got you to the point that you realize this is a problem that you really want to try to solve?
Yeah, so my background is basically I'm a basic scientist by training. So I got a PhD in biochemistry. For half my career, I went down an academic track. So I taught medical students in medical schools at the University of Washington, and then also at UC San Francisco, and also led a very active research labs. During my academic career, I was very much interested in brain diseases like Alzheimer's and Parkinson's disease. Always had a research group with, roughly 20 people in it, raised millions and millions of dollars in research funding, published 65 or so peer-reviewed publications related to brain diseases. All of that somehow, some way led me to actually starting a company that focused on sleep. But it was a little bit serendipitous. It was, it was sort of just following things versus, anything crazy. I can just briefly give you a little bit more background on that. But when I was working on brain diseases, one of my colleagues had made the discovery that your body has what's called the endocannabinoid system. And so If you're familiar with cannabis and hemp, there's molecules in these plants that are called cannabinoids. Well, he made the discovery that humans actually make these cannabinoids as well. And we are studying that system and realized that it was going to be very important medically. And so I started to get interested in maybe molecules in these plants, even though people have used them for thousands of years, maybe they actually do have medical benefits potentially. And what I saw as lacking was any real clinical testing to see whether or not they worked in humans. And in large part in the US, that was because the government did not make it easy to do that clinical testing. But to make a short story long, just kidding, we ended up, decided to focus on one molecule, one cannabinoid called CBD, cannabidiol. I'm sure many of your listeners have heard of that before. We decided to see, it had basically, in 2018, it was approved as a drug for children with epilepsy, with severe forms of epilepsy that no other drugs would work on. And people like me were interested, maybe CBD does more than just treat and calm seizures in these kids with epilepsy. And so when you looked carefully at those clinical trials in the children, the number one sort of side effect that was reported was that the kids were sleepy. So that was the light bulb for me that said, hey, maybe CBD could impact sleep, and led us down the entire pathway of let's start a company, let's fund the company, let's spend 5 years developing the product and doing clinical trials to see if it works. And, fast forward, now we're here at the early stages of commercialization.
Wow. I think for somebody who, I've always been very involved in just health and wellness and really trying to educate. And I feel like especially the newer, younger generation as well is increasingly, there is a trend towards educating ourselves on not just physical fitness, but also mental recovery as well. I'm curious if you could, just for people that may not know as much, talk a little bit about just sleep cycles a little bit and how your product really addresses that. Because I know you're really focused more on increasing the quality of sleeps throughout those cycles. So you can just tell us a little bit more.
Yeah, that's a really great question. And thank you for asking it. So when we first went to do these clinical trials, we were agnostic. We didn't know how CBD would affect sleep. We didn't even know if it did. All that we knew was that the parents of these children said that they were sleeping when they took high doses of it. So we essentially used objective sleep tracking methods. We actually partnered with a company called Whoop that sells a wrist-worn little sleep tracking device. And what that device does is tell you, when you fall asleep, how long you fall asleep. But one of the other things that it does is it tells you how much time you spend in different sleep stages. And so when we sleep, our brain isn't just dormant. It actually goes through these very important sleep cycles, as you mentioned it, more stages. And basically what it is first you're awake, then you go into light sleep, so where you're kind of dozing off. And then at a certain point, your brain slips into what's called deep sleep or slow wave sleep. And it is during that stage that your brain sends all these signals to your body to recover. So it basically allows your immune system to reset, your cells and tissues to regenerate. There's a thing called the glymphatic system that flushes toxins out of your brain that occurs during that sleep stage. And after the slow wave sleep stage, which is really important, then you go into the next sleep stage, which is REM sleep, which I think most people are more familiar with, or rapid eye movement sleep. And that's the stage when you sleep. Well, that stage too is actually really, really important. And it's more important for things like cognition and memory, emotional processing. It sort of resets your brain more or less. That's the way I like to sort of make it simplistic, that the slow wave or deep sleep really is resetting your body and immune system, and REM sleep is doing things more in terms of cognition in your brain. But basically, for normal people, that whole cycle happens multiple times in a night. So you go from awake to light to deep to REM, and that will happen, sometimes 4 or 6 times in the evening if you're normal. But what, as researchers have noted, is that as we age in particular, in certain conditions, like when females go through menopause, for example, we deteriorate. The length of time that we spend in those stages decreases. And also we see what's called more fragmentation. So meaning you don't spend as long as you should in any one stage. And so, we're agnostic. We didn't know how this product would work. But what the data told us was that surprisingly, this product seems to not do anything in terms of how fast you fall asleep. So it's not like a typical sleep aid. Almost all sleep aids are quite similar. They were what are called sedatives. So they make you drowsy. They help you fall asleep. It's kind of like alcohol, but they don't necessarily make you sleep better, actually. And a lot of them
Right.
actually rob you of these critical sleep stages. And that's why people the next morning after taking them, so for example, like antihistamines, well, people wake up feeling groggy the next day. So, when we saw this objective data, that the sleep trackers were telling us, we're like, whoa, that's really cool because number one, there isn't a single sleep aid or drug out there that does this. So
Right.
that was exciting for us. And it's important, these are the stages that we critically need for our brains and bodies. And so, I thought that this is something that could really differentiate this product in the end. So yeah, we were very excited. And the more I've studied about sleep and sleep stages, the more I realize, wow, you really need these sleep stages. And you mentioned it's quality versus quantity. So the American sleep doctors, they all recommend saying, oh, you need to get 8 hours. Now, that's true, but there's a difference between 8 hours of quality sleep and poor sleep. Many
Right.
people sleep 8 hours and don't get high quality sleep. And so, how this works, and we don't know exactly how it works, but it's interesting because it seems to slow your brain down so that you're just spending more time in these deep and REM sleep stages.
I'm actually curious about a question. It actually came up. I was doing some research on sleep stages myself, just for my own knowledge going into this conversation. And I saw that there was something about every hour and a half, roughly every 90 minutes, is when somebody transitions into the next sleep stage. So a lot of people that are told 8 hours, right? A lot of people that wake up after 8 hours, they still feel a little groggy. But I just followed the math like every 90 minutes. So at the 3 hour mark, at the 4.5 hour mark, at the 6 hour mark, at the 7.5 hour mark, and then the 9 hour mark are technically the periods that you're at the end of a sleep cycle. So when you wake up at the end of a cycle, you're a lot more refreshed than when you're in the middle of one. So for me, it was 7.5 and 9, just doing that. But I'm
Yeah.
curious, obviously, somebody like you who is much more like has studied this, how true is that? How true are those
Yeah,
90
so
minutes?
that's also a really good question. And it's intuitive to think that that's how it would work. And generally, you're right. But the problem is that humans are highly variable.
Right.
And so while it's true that, most people go through these cycles, exactly when they go through it varies quite a bit person to person. And then there's another thing that a lot of people don't, isn't common knowledge. When I mentioned those deep cycles, they tend to occur early when you fall asleep. So they're typically in the first or second cycle, and then they shorten as you get closer to waking. Whereas the REM sleep stages tend to be more pronounced at later sleep cycles through the night. So in say your third and fourth sleep cycle. And so you're absolutely correct that like say um, you're falling asleep and you have to wake up to go to a flight the next morning and you happen to wake up in that deep sleep stage. It's the worst feeling, right? I mean, you just feel like you're lethargic and it's hard to get out of it. I mean, I joke about this, but one way to think about deep sleep is say one night you couldn't sleep for whatever reason. You had a dog that was sick or something and you were taking care of it. And so then the next night you're really, really tired. And when you fall asleep, you actually sleep super deeply. And the reason that is because our brain knows we need deep sleep. So there's a rebound effect, right? So if you don't sleep one night, the next night, the first thing that happens is you have a lot of deep sleep. And when I
Right.
say deep sleep, it's the kind of deep sleep where, drool's coming out your mouth, that kind of deep. So, yeah, it's so important. And unfortunately, it is quite variable. And, what I always recommend is if anyone has any sleep tracking devices, this could be a Fitbit, a Whoop, or a Ring, Apple Watch, Garmin, so on, track your own sleep over a period of time and not just a night or two. You really need to track it like over the period of, I would say at least a week, sometimes a few weeks would be even better to see what your brain is doing at night. And that might help you guide it to do better.
Yeah, no, I figured as much too. I was like, there's no way every single like our body is very intelligent it's beyond our beyond our knowledge, the way that we work. But I figured I was like 90 minutes, every 90 minutes, like I can just time myself and set my alarm. If I'm going to bed at 12 o'clock, I'll just time myself to wake up at 6:30 and I should technically feel refreshed. So it's good to get for people that are kind of like me and not as knowledgeable about these cycles. It's not as simple as that when it comes to
It isn't. And one last thing I should point out, because it's very common, is that unfortunately, alcohol is kind of the enemy of a lot of good sleep things. And so alcohol in particular does work as a good sedative, so it will make you sleepy. But if you have a little bit too much, and most people would say that that's more than 2 drinks, then it actually decreases deep sleep. So you sleep, but you skip or diminish those sleep and sometimes REM stages as well. And so that's why you wake up not feeling good. So there's
Sure.
many things. There's other life factors as well. Stress, anxiety, different things can trigger changes of those cycles. It's not like it's fixated every single night's the same. Yeah.
I want to just on this subject, really just talk about, I think the most seamless transition would be look at the industry as a whole. So if we're looking at just health and wellness right now is obviously in a very, very dynamic phase where a lot of people are starting to really take uh, better care of themselves, whether that's physically, whether that's whatever the case may be, like even just mentally. I know a lot of people that are starting to practice meditation, practice better sleeping habits, do a lot, go to the gym a lot more, look after their diets a lot more. But with so many different sleep solutions, and we kind of touch base on some of them on the market right now, what do you think now over the next 5 to 10 years, as more information continues to come out to people, will separate credible companies from a lot of the people that are just kind of, like you said, giving a product that will put them to sleep but not really help them at all? Like, what's going to be that differentiator over the next 5, 10 years in this market that's very rapidly evolving?
Yeah. So I think you're absolutely right that more and more so us humans are really trying to take control of our own health and well-being and wellness, even with the sleep tracking devices. I was surprised to learn that like, in the US, something like 70 million people use these things. I mean, it's not a small amount. And I think in large part because humans are kind of fed up with the big pharma model and just take this drug and, with these side effects like your brain's going to hemorrhage and things like this, and so I think people more and more so would like to turn to more natural plant-based products. But having said that, the wellness space is sort of also on the flip side riddled with snake oil is a
Yeah.
simple way to put it. So I can't tell you how many companies I've seen that will, label a product like sleep aid or you know, knock you out or what have you. And then either there's no real evidence that it works, or perhaps it just has things that, like you said, might sedate you or knock you out, but actually not really do anything to the quality of your sleep. So it's really rampant. And, our product's based on CBD. And even in the CBD space and the cannabinoid space, it's probably even worse. I mean, there's thousands of products that will claim to, you know, cure everything from your sleep to even anxiety in your goldfish. So I'm not sure that I'm a great person to sort of expound on, where I see the industry going, but I do believe that consumers want products that work and are safe, and I think that in the end, a lot of these products that are kind of fly by night, yeah, trust me, it works, bruh, sort of thing. They're going to come and go because I just think they don't work or they have negative side effects that people realize quite quickly. So, I think I at least see more and more companies turn into science like what our company has done. I mean, I've seen a lot more companies start to move into that direction because I think in the end, the consumers are going to demand it. And that's what I think. So, but it's not easy. Having said that, not everyone really has the expertise or background or even
For
resources to be able to pull it off. But for us, in the end, when people ask, like, why would he go out to all that time to do the clinical trials if he knew it worked? It's like, because we wanted to be sure.
right.
We wanted to, also, the safety is no joke, on these things. So I think it's anything, especially for disorders like sleep disorders where someone might take it chronically every single day, you have to be very careful. There's a lot of things like drug interactions and liver toxicity issues and so forth that you have to be aware of. I think, I've always been a proponent, like, do lifestyle interventions first if you can. You mentioned those, like your diet, your exercise, good sleep hygiene habits. But, there's just a lot of people that, despite doing all that, still struggle with issues. And so, sometimes they want to turn to things like supplements. And I think there's a role for them.
Yeah, no, definitely. And I think a lot of people are You kind of touched on it, but really, really just looking at reliability. We live in an information economy where there's so much information out there. And a lot of times you don't even know if the resource or the source that you're getting your information from is legitimate. And that goes across the board, whether you're looking at health advice, political information, whatever the case may be. You need to really double check and fact check where you're getting your stuff from. But I really want to kind of transition this to more of like from a high level business conversation now. Obviously, somebody who is as knowledgeable as you from a with a scientific background and all those things. When you're talking about now educating your market and also bringing this product to market from both a marketing and sales perspective, what is working really well for you today that you can maybe share? And also, what are some things that you may see are things that need to be optimized a little bit as you continue to bring this product to market?
Yeah, good questions as well. So, first, I just want to acknowledge that, as you said, I'm a scientist, so I am not a marketer. And so, the first thing we had to do after 5 years of doing the research and then publishing that research was to bring in people with expertise in marketing. And so, essentially, we, started commercializing about a year ago, have started to launch different marketing tactics to see what works or not. Like many things, even though sleep is a very widespread issue, how you actually obtain customers isn't as trivial as you think it would be.
Right.
So for us, what we've decided to do first and foremost is that we can go to direct to consumer sales. So we have a functional Shopify website, and basically, at least in the US, you can one click order and get it delivered to you within a day or two. So our main marketing efforts really center around direct to consumer marketing, meaning social media, ads and things like this. And that has worked, but even that has required some dexterity, I would say, because, even within that, there's ways of doing specific marketing to specific segments that are more prone to like a product like ours and so forth. And then there's different platforms that you can use. And, you really do have to find your customers. So we did a lot of tests, different platforms, different types of creatives, and so forth on that space. It wasn't just as simple as you'd think. And in the US, we have restrictions as well because you can't sell on Amazon, we can't advertise on Google. So that just makes it all more of a headache. But by and large, what we're trying to do is direct to consumer marketing and doing things like this, like podcasts and other forms of media, email marketing, a lot of different things. We go to consumer conferences. The other huge area for us, though, that I think for us is really going to be the Trojan horse that wins in the end, is that we really try and engage with the medical community to educate them about our product. And specifically, we go to medical conferences like the sleep doctors conferences. We go to the American Psychiatry conferences. We go to OBGYN conferences. And we talk about our research there, and we talk to the doctors about this product and more or less educate them to let them know that this is a viable alternative to other things they might be recommending, like melatonin, for example, or other over-the-counter things, ZyQuil and stuff like that. Once you start to talk to the doctors and show them the direct comparisons of this product versus all the other things on the market, they are very quick to adopt it because they know that it's safe and they know that it works and it doesn't have these sedating effects. So, it's
Right.
not going to intoxicate you. It's not going to cause fall risk in an elderly. So we've really done a large amount of work to try and engage with the medical community. And we track all our sales, like to see where they came in from. And actually, well over half come in as doctor recommended now. And so, for us, in the long run, that could be really great, right? Because some doctors in the sleep clinic might see 30 patients with insomnia a day. I mean, it's a large market. So it's always the question of how do you tackle it. There's also been things that have not worked as well too, but I don't know if it's worth spending too much time on those. But yeah, for sure, it's much like science to me. Marketing is trial
Yeah.
and error and seeing what works and fixing things, and then scaling channels that are really working. And if our whole goal is always to try and do well in one channel, and if one channel works well, then scale it and then go on to the next one and try and expand.
Yeah. No, that's and right now, are you managing like it's because you're obviously the founder of it, but you're more. So do you have a sales team? Do you have a marketing team? Like, how are you managing those things?
Yeah, we really don't have a sales team actually for now. We would like to. We're actually in the process of fundraising right now for to scale our company. And that might be one thing that we're probably going to include. For example, you could do traditional like what pharma might do in terms of outreach to clinics, medical clinics, and some of them could even carry our product. But yeah, no, all of our team, it's small and nimble, so we have marketing and creative people, and then we outsource a lot as well. So we definitely do that. We have a team working on SEO and AI optimization and things like that. Yeah, it's small, but
No, it's
ultimately, actually,
you'd be surprised. Like a lot of people, like you guys are actually ahead of the curve when it comes to modern day marketing because a lot of people that I've actually spoken with, and you'll see like in past episodes as well, but a lot of people are kind of stuck on just traditional SEO as thinking
yeah,
like, we'll rank high on Google, enough traffic will come, and but the market no longer works like that. Like Google search results and search volume, ever since I think it was mid to end of 2024, for the first time started declining after OpenAI and ChatGPT and Gemini and everything were like becoming the main browser for most people. They're no longer using Google for it.
yeah,
And that's
yeah.
where AI optimization came in. But that's also where content creation and social media started to change because Facebook algorithms started to change. They were no longer, if you actually go on I don't know if you have Instagram or anything like that, but if you go on an Instagram ad now, before you would have like a 10-second ad and then you would just scroll and then you might see another ad underneath it. Now you'll see 3 to 4 similar ads actually jumbled together because they kind of don't separate them anymore. So a lot of people now, if you're scrolling through stories on Facebook or Instagram, you'll see like a story of, for example, you're talking about sleep medication right now or a sleep aid. You'll see one sleep aid company drop their product. You skip to the next story, but it's the same. It's like another sleep aid company, and it'll be like four of them that Facebook just has like jumbled together. And what it's doing is a lot of companies now, like they're finding it more difficult to differentiate because they're being jumbled by an algorithm now. And there's just little things like that. But you guys are doing a great job, honestly, when it comes to the
It's
fact that
funny because that's a lot of how I get my market intelligence.
really,
Oh, it's hilarious. I mean, I guess because I'm talking about it, so the phones are listening, right? And so all these ads that are targeted to me are all related to products, the product that I sell. But you're absolutely correct. And what's tough, I would say when you're small is having enough human capital and then having enough working capital to do everything. And there's a lot of things you want to do, but you just can't do everything. And so you kind of have to focus on things that you think are going to make a direct impact on growth and revenue growth. And
totally.
so it's been a challenge. It's been, I thought the research was hard, but the marketing's just as hard, if not harder.
Yeah. I think marketing, like once you get into it, like even for me, it was when I first started a few years ago, it was like, wow, this is completely different than how I originally thought it was going to be. But nowadays, the thing is, I think what I've learned is that marketing teams and sales teams, they don't need to be as robust as they once did, as long as you have the infrastructure and the system underneath it. So a lot of people now, like if you have, for example, like you're what you're doing a great job with, you have like you might be leveraging LinkedIn or email or social media ads or whatever the case may be. But you have a system where like if it's outreaching on autopilot, like it's sending these messages out, it's educating people with different like ebooks or whatever you may have to educate them. You don't have somebody on your team sitting and replying to everything consistently throughout the day. You don't have somebody creating new ads for you every single day. Like everything is consistently optimized for you. That's kind of the easiest way that I've seen like smaller companies start to scale. And you'll actually see one episode on the channel too. I believe gentleman's name's actually Jeff. He's in the skincare space, not really sleep aid, but he was scaling his business the same way where they were originally reaching out to B2C, but then they actually had a beauty professionals program. So they started reaching out to the Sephora's and the pharmacies to try to get their products on business shelves, essentially. And that's
Yeah,
where
for sure.
yeah, that's where they started, like, really taking off. So, I think there's so many ways that you guys could
There are. There's no doubt. I mean, I didn't even talk about it, but the other channels that we're really trying to work on, but again, it's been limited so far by human capital, is that there's actually a ton of other companies in the sleep space that are successful, including many sleep app companies, right? That have sometimes hundreds of thousands of millions of users, so we're definitely doing, business to business outreach with some of these companies to see if we can partner in some capacity that would be mutually beneficial. But I think that actually might lead to faster growth in the short term for us, for sure. Like I personally think that there's a limit to what you can do with the consumer marketing. But one thing I was just going to say that when you were talking about that, sort of in the end, I mean, what I always think about is it's compelling storytelling, right? I mean, in the end, like, can you stand out? Do you stand out? So one of the things we've been working on a lot is to develop really bona fide content that's genuine, right? We have consumers who take our product. I can just give you one example, like an ICU nurse, like a critical care nurse that for 30 years has worked, 3 nights a week, 12 hours from 7 p.m. to 7 a.m. And just that kind of shift work wrecks your sleep. And they've tried everything to try and sleep better, from melatonin to some of the more hardcore Z drugs like Ambien, so forth. And those things are just not healthy, so they don't like them. Well, sometimes we've met people like that who've encountered our product, and they literally will come up and like hug me and be like, I can't believe this is the first thing I actually has helped me to have better sleep quality and not feel like crap the next day.
That's super fulfilling too. Like even beyond just the business side of it. Like I'm sure when you get those types of responses to what you guys have been able to build, it's just rewarding, and it kind of shows all the work you put into those clinical tests and everything that you put in when you see
Yeah.
those responses coming in. I can't
Yeah,
imagine.
that's what really actually keeps me going in then, because you get bogged down in the details and you get frustrated, 2 steps forward, 1 step back, everything, so on. But in the end, you have to remember the big picture of what we set out to do, which is to help people who struggle with
Absolutely.
sleep. And when you see that, then you're kind of like, shoot, how can I not get further exposed? There's all these people out there struggling, and we just need to connect to them.
Absolutely. Oh, this has been great. I want to, before we wrap up, I've actually prepared a few kind of rapid fire style questions for you. Uh, two of them are about a little bit more business, two of them are more personal, just to kind of get to know you a little bit better beyond just the founder of Deep Sleep, Defined Sleep. So I guess the two business related questions would be, where do you want to be 6 to 12 months from now as a company? Where do you see yourself?
Well, I would like to have closed our funding round and it be off and running on scaling the channels that we've shown that work. So, I'm really excited to see that hockey stick of growth, and we're at the early stages of it. So I'm like, that's where I'd like to see us.
Absolutely.
um, and there's also a short answer to that too, is that we want to continue going back to doing more research. We're really interested in autism and some other areas that we're going to do more clinical research on. So I'd like to be able to hopefully get enough growth in the company that we can continue down the research track.
Right. That's awesome. That's awesome. If you yourself woke up tomorrow morning as a wizard and you could wave a magic wand and you could just fix one recurring challenge, whether that's inside your business, that's just publicly in the industry. If you had the power to just fix one challenge that you're kind of going through every day, what would that be?
Oh, that's a tough question.
I'm making you pick one.
Yeah, if I was a wizard, then I would hope that I could like make the pot of gold or something, maybe. No, I don't know. There's a lot of challenges, and I think in business, you're always faced with challenge, I think. I mean, and it's not, in science is not all that different. In science, people don't get this, but 9 out of 10, sometimes 19 out of 20 experiments don't work. It's a game of failure, and the person who wins is the person who can actually, look at failure and move on and learn from it. And so, yeah, I don't know that there's one thing one particular thing. I mean, big picture things, I'd love for our company to get back to brain disease. It turns out now that things like Alzheimer's appear to be really closely linked to lack of deep sleep. So I find that quite interesting. But, to do Alzheimer's trials would be hundreds of millions of dollars.
Right. Right. I
It's not
mean,
on the short-term agenda.
absolutely. Absolutely. No, I feel like what I like about what you're kind of where you're grounded at is there's so much potential for where you can take this in terms of different ways to go. But honestly, I'm wishing you the best when it comes to just being able to scale this sideways. And I'm hoping obviously anybody that is getting some value from this conversation, you also realize the value of sleep and recovery. It's not just we live in a world where everybody's just go, go, go. You just have to do the next thing consistently. Just make sure that this is a huge part of your day to day and just making sure that you're taking care of yourself. So that's definitely a message that I'm hoping that our audience is able to get from this. But to wrap up, really, Paul, like I just want to know, like, what is next for you, even after you obviously scaling this business, wherever it ends up being. What's next for you personally, both as a leader and also like 10 years from now? Do you see yourself on a beach somewhere in a country? Like, what does that look like for you?
Well, so I'll start with the second part. I'm kind of like the person who needs to be busy. So,
Mm.
I'm at the age, sadly, where a lot of my friends, I live in San Francisco, the tech, right near the tech capital of the world. I can't tell you how many of my friends are like, oh, I'm so excited to retire. Company just got bought. I'm going to retire. And I think that's great for some people, but it's not for me. So I don't see myself sort of just like, golfing more or things like that. So I love the research, and I think the scaling and all that is fun and it's great and it's a means to end and, hopefully the revenue goes the way we want it. But if we have a high enough success, what I want to do is just spend more time doing more research. So I really like doing that. And I mentioned earlier, I'd like to do some more research in autism. We're also, which there's a lot of people with autism have sleep abnormalities, and maybe if they sleep better, their autism might be better. As I mentioned, also with brain diseases like Alzheimer's and Parkinson's, there's a close link. So I'd love to get into more of that. One of the ideas that I've had is I might actually start a nonprofit research institute to sort of lead that research. So if we have enough success at the company, but yeah, that's sort of, I guess, where I see myself and going.
That's amazing. That's amazing. Like one thing I'll always respect about your generation of people as well is like our generation is like we have our select group of people that at a younger age, we've kind of just started working, working, working. But a lot of us, especially I feel like AI has made a lot of people very lazy. And like a lot of people have just found shortcuts. Like I see my nieces and nephews now growing up through the school system and they have all their work kind of done for them. Like they're not really studying the same way that we had to before. So I definitely think your generation was the last generation that really had to work for every single thing throughout their lives. And then our generation is now the bridge between the next one that's coming up, where everything is kind of really a lot easier. I just have to be like, I think that's what it is. A lot easier. There's a lot more opportunity. Uh, and I feel like it's really, really cool. But Paul, I'm
Yeah,
really, really,
it's a scary, right? I mean,
yeah,
it's really, I have kids and it's like it's it's a whole different world, right? And
completely.
just when you think about how much information you have access to relative to my generation, right? Just at your fingertips, right? So I don't think anyone really knows how to grapple with all of that. And yeah, but for me, it's funny because we use AI a lot in the company, but to me, it gives me too
Yeah.
much work. I'm like, oh shit, like I can't keep up with it.
Yeah, I think it's funny because a lot of people think AI is just going to replace like your entire workforce, but it's just meant to obviously complement it. But I find it really cool, like with information nowadays too. Like I feel like humans were never meant to absorb as much information as we're absorbing consistently now. So
I agree with you. That's what I'm
yeah,
scared about.
yeah. So I think it's really, really important. That's why products like what you're bringing to market, and also just I always preach even to my internal circle the importance of disconnecting, get out in nature, take care of your mental health. It's very, very important. Don't just be on the phone looking at news all the times. Um,
Oh yeah. Yeah. No,
really, really, it's easy to fall into that trap.
well, in the we don't really know the long-term risks of all that.
Absolutely.
And what we do know doesn't look that good. We're, so yeah, it's a tough situation, but yeah, no, I do, even with sleep, like we mentioned at the beginning, but it's, you can't just fix everything with a Band-Aid, right? I mean, you have to think about it more holistically, and that includes a lot of different things, but, health, well-being, psychiatry, exercise, your diet, how you interact with people, all that's really important.
Absolutely. Paul, where is the best place for people who are watching today to follow your work and also just connect with Defined Sleep as well?
Yeah, I mean, the easiest way is just to go to our website, definesleep.com. And also, we have another website that we just put out there that's really educational in nature. It's called CBD for Sleep. So just cbdforsleep.com, which reviews everything you want to know or learn about any clinical trial that was done with CBD and what's positive, what's negative, and so on. So, and through my website, if you want to reach out to me for anything, either we have a support email, you can just reach out that way. But yeah, it's been a real pleasure. Yeah, we hope to also, another thing you mentioned is with the scaling is that we'd like to expand into other countries, including Canada. So
All our
that's,
Canadians out
that's,
there, keep an eye out. I keep an eye
yeah,
out, and then hoping to
that's right.
for all the best again, Paul, with the business, the company, and hope to obviously, like, as you continue to scale, as we continue to build this platform as well, because we're also building this platform. We're in the early stages, bringing our first founders kind of on. But as we continue to scale, build a bigger audience, we'd love to have you on again and kind of get an update
Great.
on
Well,
where
yeah,
you're at.
yeah, really good questions. Thank you.
Awesome. Thank you so much for your time. Appreciate it.
All right, take care.